Welcome back. My name is Dean Berg, and you're watching the instructional video series from Anika Media on the benefits and ultimate ROI of leveraging social media in healthcare. In the first video, we talked about how social media can be used as a tool to help you solve some of your largest healthcare challenges. In this video, video number 2, we'll start by identifying some of those challenges. At this stage in healthcare reform, most of us in healthcare feel like this. Reimbursement is quickly ratcheting down. Our hospitals and physicians are about to take on the financial risk of managing patient care through ACOs, and a little something called patient experience is somehow going to determine our reimbursement. Our physicians and nurses are more stressed now than at any point in the history of medicine. Because of this, it's understandable that they're making lateral moves. They're trying to find security. They're trying to maintain their income. It's hard to recruit them. It's even harder to retain them. And our perception is that our competition is doing it better. We see their ads on the TV. We hear about them on the radio and from our colleagues and our patients. Do you have a Beaumont doctor? Is your doctor a Mayo doctor? Our competition appears to be connecting better with their patients, their referring physicians, and their own physicians and nurses. But we use all the traditional marketing channels, TV, radio, we have brochures, we have flyers, we've even built this fancy website. It's our belief that all hospitals share these common goals. We want to do a better job of recruiting new patients, referring physicians, and our own physicians and nurses. We want to improve patient throughput in clinic. We want to reduce the use of expensive resources, especially those non-reimbursed resources like call centers. We want to better connect with our patients for improved healthcare outcomes. And finally, we want to reduce our patient leakage and our physician turnover from our healthcare system. In short, we want to provide a higher standard of care on a reduced operating budget. We want to thrive, not simply survive. That's a lot of pieces to fit together. So how do we propose that a strategic social media program can help us to solve all of these challenges? To help us to meet all of those goals? Do you know what your operating budget is? Do you know what your operating margin is? For those of you that may not know the exact numbers, we'll use some industry standards to help us with the purpose of calculation. Would you believe that a strategic social media program can help you to reduce your operating budget by 1% or more? Do you care? Does that matter? Is that significant? Would you believe that a 1% reduction in your operating budget can mean as much as a 5% increase in your operating margin? Now do I have your attention? If so, I think that you'll be very intrigued with the upcoming videos. In the next video, we'll start by defining the term social media. Social media can mean a lot of different things to a lot of different people, so we'll identify one common definition that we can use throughout. From there, we'll explore the evolving patient, the patient that wants to participate in their health, the e-patient. We'll walk through several applications of social media and its potential ROI. We'll look at common objections. And finally, we'll talk about how to get started with a strategic social media program, a program that could add 5% or more to your operating margin. Please select the next video from the list. And if you'd like to calculate your own potential ROI for your organization, please download our free digital workshop. Our digital workshop consists of a workbook and accompanying videos to walk you through the step-by-step process of calculating your own potential ROI for your organization. We hope that you enjoy the video series. I thank you for listening, and we hope to see you in video number 3.